Talking to Rachel Barkley, Executive Director at Able Americans, targeting Medicaid fraud while protecting the disabled. Hi, Rachel.
Hello, Fawn. Good morning.
How are you?
I'm doing great today. It's Friday.
Oh, thank God. All right. So, when it comes right down to it, there is so much Medicaid fraud. And if we rooted it out, can you imagine how much tax money we would save?
That's right. And it would go to those who really need it, which is the important thing.
Yeah. So, just a ballpark. How much fraud do you think we actually have?
Oh, wow. That is a tough question. It's such a huge program. $880 billion nationally. It's hard to imagine. I don't know a ballpark. Maybe, 15%, 10%?
Oh, my gosh. And if you think of how much there is, that is a giant number.
Yes. And that's just fraud. I talk about it's important. There's fraud, there's waste, which is legal, but spending money poorly. And then there's abuse, which is also legal, but it's people who find loopholes in the legal system to abuse it.
I see people on Medicaid who obviously meet the criteria, or they wouldn't be on it, I'm guessing. But then I see stories of people coming in from other countries and they're on Medicaid and we're paying the bill. We can't afford to take our kids to the emergency room. No offense to the medical centers, but medical care is expensive. And if you don't have insurance, you're kind of screwed. So if we are giving this to illegals and people who don't actually need it, who are fraudulent, those of us who could really benefit from lower prices are getting screwed by the people who are abusing Medicaid.
And, Medicaid, when we talk about Medicaid, there are so many different parts of it.
Yeah.
There's Medicaid as normal health insurance, which is, the kind of typical Medicaid. But then there's Medicaid home caregiving and community-based caregiving. It's called HCBS, Home and Community-Based Services, that helps really the severely disabled who need a lot of extra care or else they would be put in an institution. It allows them to stay at home and have that caregiving support, stay in the community, stay working even as taxpayers with that caregiving support. And that's often what we're talking about in this fraud situation.
Mm-hmm. I know people on Medicaid who use it wisely. They only go if they're really sick or if their children need dental exams. And I want our kids to be taken care of. I want them to have preemptive care where we find out if something's wrong before it gets out of hand. I want that. And I want that for people who are disabled, who can't care for themselves. I want them to have, constant checkups to make sure they're okay. I am totally cool with that as a taxpayer, but I am not cool with the person who's on Medicaid who goes to the emergency room because they have diarrhea. I'm not okay with that.
Yes. Yeah. That, it's healthcare is so complicated, and I think you're talking about, that's Medicaid used as insurance, and
right.
Certainly,
and it's misused.
Yes,
yeah.
Yes, I imagine that. So I think, when I look at the big fraud cases, I saw your Attorney General, came out and found some fraud.
She did great. She's a pit bull, man. We love her.
Yes, and so important. States can be doing this oversight, should be doing this oversight, and it looks like your state is doing that.
Yeah. So how do we get to the point where there is transparency and we can see the waiver wait lists and all the things that you list in the information that I was given, how much money we spend per person for expenditure? Because I know a crackhead who went in and had a lung removed and didn't have to pay a penny. Now, if you or I did that, by the way, she's still smoking crack with the one good lung. But I'm just saying, if you and I did that, it would be $1 million bill.
Yeah, our report really focuses on that disability population and not so much on Medicaid as insurance, but Medicaid, the caregiving piece of it. And so we just really call upon states to use the federal funding that's available to create transparency so that, if you were to go on your DHS's website, you could see how many spots, where you're at on the wait list for these kind of services, and then you could see who all of the providers are, aka the caregivers or the companies providing services, and what their hourly rates are, which is really important because, we saw abuse out of Indiana where they had an autism therapy provider charging $640 an hour just to often do really basic, not even medical caregiving, service, almost babysitting. And so if that had been, public, I think we would have caught that fraud sooner, what that provider was charging in an abusive way.
Yeah. I'm sorry. I just keep getting stuck on the abuse of it. It drives me absolutely bananas. But you're right. We've got to find what it should be an across the board rate. I mean, why can't we do that? Why can't it be like a menu at a restaurant?
Right. Exactly. And, it is, complex. A lot of these things, you can have a caregiver who's providing really, more difficult services like changing out somebody's ventilator and, these kind of things versus, just watching somebody for safety if they have a serious mental illness or something. So there's, a broad spectrum of types of disabilities and needs, but that does not mean that the different types of providers can't be their rates be made public.
Right. And, I've heard from many medical caregivers that Medicaid pays a fraction of what they would get from somebody who has insurance. I'm like, but if what you're saying is true, where some are just overindulging in what they're charging for things, is it true? I mean, I don't know where to go with that, but if we know what it's going to cost up front, then everybody would be the same. Does that make sense?
Yes, and I think, again, that kind of lower reimbursement rate, that's at Medicaid is kind of traditional insurance. I think that is typically true of, primary care or these types of things. But where the rates vary widely, and we don't have insight into that, is in this caregiving for people with disabilities and the elderly through home and community-based service waivers. And so it serves, not just the taxpayer, but the person who's looking for care to see what's out there.
Right. Because sometimes they got to pay part of it. But, do they have to show, I don't know what we would call them, like their logs? I mean, their records, do they have to show what they charge people? And is this how we catch abusive practice?
They have to show it to the state, but the state doesn't have to show it to the people. So that's what we're talking about with transparency. The other thing is, when I looked into what cases were caught in Missouri, almost all the cases were the providers logging hours that they didn't actually show up for. So they lied about that, I provide 12 hours of care, and they didn't provide any of that care. And so having those logs is kind of like they watched it.
That's embezzlement.
Yes, exactly.
So are we charging them? I mean, if people get caught doing stuff like this, you know what? They should do some time.
It looks like your Attorney General did, crack down through the Medicaid Fraud Control Unit on that.
Good, because that kind of stuff makes me bad. Everybody just seems to think when they talk about our tax dollars and they talk millions and billions, nobody blinks an eye. Does anybody really realize what a crap ton of money that is? I mean, it's a lot of money what we could be doing so many good things for homeless populations and veterans and, all sorts of people we could be helping, like children and elderly people who actually have disabilities or people with autism could get so much more help and easily accessible help if we would just stop the fraud.
That's exactly right. And, by wasting these dollars or defrauding the public of these dollars, people sit on wait lists for care and desperately need this help. You talk about families that have children with disabilities that are just drowning and need the help. So ensuring that those people get the help that they need is why we want to crack down on this fraud.
Yeah. Well, if we could cut out the middlemen, that would help. I mean, seriously, in every aspect of life, that would be much, much better. And even when I'm booking the show, if someone says, I'll get a hold of them for you, I'm like, nope. It's got to be direct contact because middlemen make everything take longer and cost more. So no, I'm not doing it. But if we could just do that. But I have about a minute left. What do you want to say that I didn't ask you?
You hit on it. Especially in healthcare, so many middlemen. If we allowed families and individuals with disabilities to have control of their own dollars and their own care, I think they'd make better choices financially, and we wouldn't have as much fraud because people would, cut through the fat and get what they need.
Yeah, and you know what? Dignity comes into factor here because I have family members with special needs. That's why I get so fired up about this. Their dignity needs to stay intact. It's not their fault that they are the way they are. So I just want people to take that into their thought process when they understand that people are being fraudulent with our Medicaid dollars that could go to people to help them maintain their dignity. I think that is one of the most easily acceptable things to ask for in this world is for us to be allowed to keep our dignity. I mean, we're not making you walk down the street naked if you don't want to, because you did something wrong. We allow you to keep your dignity, and that's just a basic human right.
That's right. And so these dollars should do that and do it well and not be spent poorly. So that's exactly right.
Okay. Where do people go to learn more about Able Americans and this study?
Yes, the whole study can be found at ableamericans.us.
Okay. Sorry I kept getting off on the insurance part of it, but I know of so many people who misuse Medicaid, and I just really, gosh, if there could be an anonymous hotline. I'm just saying.
We need that too, yes.
Yeah, we do. Rachel Barkley, Executive Director at Able Americans. Thank you for your time today, Rachel.
Thank you, Fawn.
Bye-bye.